Hello to everyone. Now we go and talk a little bit about breast cancer. This is the Cancer Prevention Seminar, and we will talk today about an important cancer for women. Last time we talked about prostate cancer, was essentially for men. Now we are going to talk about breast cancer that is mostly for women. As we see in this slide, the most common cancers for men is the prostate, and for women is the breast cancer. And the difference is very big, according to the American Institute of Cancer Research. And this is in the world. So you see that is an important topic for a lecture to be in our cancer prevention seminar, breast cancer prevention. The detection of this cancer will start with a nodule in the breast, or a change in size or form, or a change in secretion, or the presence of secretion, like in a woman that is not breastfeeding, or even blood in the secretion, or in an appearance in the like a red spot or appearance in the breast could be something that should be a cause for checking. Self-examination and mammogram help to make an early diagnostic and a successful treatment. So without any doubts, there is a lot of concern about self-examination nowadays. We talk about PSA and the discussion for prostate cancer, and then there is a big thing about self-examination. Some doctors are telling that women should not do self-examination because they don't know much about the breast, and so why you do that? Well, I have an experience about that, and I tell my wife that she should know a little bit about her breast and how to do a self-examination. But the doctors are saying that this should be for the checkup. The doctor should do an examination of the breast frequently. The problem is that when my wife went to the doctor even didn't touch her breast. It was a female doctor, and she didn't even talk about that. She sent her directly to the mammogram. And so if you don't do the self-examination, the doctor does not do the examination, the clinical examination, you are only left with a mammogram. So I believe women should continue to learn to do self-examination of their breast, should be familiar with the breast, and should be familiar with the technique in order to prevent, in order to find an early diagnosis. In the United States, the incidence of cancer is 75,000 75 to let's go back there. Breast cancer statistics. In the United States, 75 to 100 women are diagnosed with breast cancer per 100,000. In Africa, the amount is 25 per 100,000. So again, this is a cancer that is common in countries, developed countries. So might be related to lifestyle. And I say that because when immigrants to the United States coming from these countries, they assume the same levels in 1 or 2 generations. The 60-year survival in the United States is about 73%, and then in other countries are 57%. The problem here is mostly related to diagnosis and also a little bit on the treatment that is available in this country, and mostly because it's not that the treatment is not available in other countries. It might be available, but it might be costly, it might be delayed because of finances, or the main thing is that women are diagnosed too late. What are the causes? Well, the main cause is lifetime exposure to estrogen, that is the female hormone. The female hormone estrogen will promote the growth of the breast cancer cells. And then if a girl has early menarche, that means the first menstruation is very early in life. And then if the last menstruation, when they start menopause, is very late in life, so the period of exposure to estrogen is too big. Also, if the person, if the lady never had a child, and so comparing to those that have 2 or 3 children, they have years of lower exposure to estrogen. So it is a protection to have children is a protection against the cancer. Also, if a person has children late in life, is an increased risk for this cancer, because he pass a period in life that has a higher estrogen level or exposure. One of the problems that is happening today in our civilization is that the menarche, the first menstruation, used to start in the 1900s around 17 and 18 years old. So the first menstruation was late for women. Now, in our days, at least in 2009, according to some studies, the menarche is happening with children with 12 and 13 years old. So we have these children also having child on that age, what is terrible. But as it starts that early, the exposure, the production of estrogen will be higher. And this is highly influenced by energy foods that are given to these kids, more fat, more sweets, more junk food. And also is I would say, triggered by the social sexual revolution. And then kids are more influenced by the media and the messages on sex very early in age, and this kind of trigger the advanced development of sexual function and maturation. Also, radiation, overexposure to X-rays, mostly during puberty, might increase the risk. Hormone replacement therapy for women that are in menopause might increase breast cancer risk. And even a mix of progesterone and estrogen might have a small effect on the cancer, on the production or risk of cancer. And then there is also some evidence that using birth control pills or contraceptive pills might increase the risk of this cancer. And then this cancer is very highly genetic. And then we know that alterations in the genes BRCA1 and BRCA2 are related to this cancer. So family history is important. And then we know that 1 in 10 cancers are caused by genetic alterations. not all of these, but once a person has the risk, when a person has BRCA, they have 87% increase of cancer risk and 40% increase of ovary cancer. That is very high, and so women that are positive, that has a family, they have to be careful on that. So here we have the different types of BRCA1 and BRCA2 and the risk of breast cancer compared to the general population. So it is increased risk, as you see in this graphic here, according to the age, and so the risk is increased much more than in the population. So that's why it's important to check these for women. If a person does not have opportunity to check the BRCA gene, they should at least be able to check their family, like multiple cases of early onset breast cancer, or if there is a family history of ovarian cancer, or a family history of breast cancer and ovarian cancer together. If there is a history of bilateral breast cancer, or if the person is from Ashkenazi Jewish heritage, that means the Jewish that are more European, more blonde Jewish than the Sephardim type of Jewish that are more Latinos Jewish. A family history of a male breast cancer also is important, and a personal history of ovarian, uterus, and colon cancer are important. So all of these factors are important for the prevention or for the early detection of a family history of breast cancer. It's important to check for this, and what you are going to do if you have a BRCA positive or a BRCA negative is something to consider. But we have a history of a person, family celebrity, Angelina Jolie, that had this surgery for breast cancer, and so we will check, we will pass the video of her struggle with cancer and how she did a surgery to prevent it. I'm not saying that we should do it and that people should do it, but at least you should be familiar with what you should do to prevent this thing.
She's battled CIA assassins and evil scientists as a movie star, but Hollywood A-lister and global activist Angelina Jolie is now waging a real-life war against a disease that threatens to cut short the lives of millions of women. As ABC's Cynthia McFadden found, it's her newly public battle against the risk of breast cancer that has turned her into a true inspiration for women around the world.
Wherever she goes, whatever she does, Angelina Jolie captures headlines and the limelight like a magnet.
In some ways, it seems you've used the sort of jujitsu move of celebrity. All of this enormous spotlight on you. You seem to want to turn around onto the people who would otherwise get no attention.
And that's the positive thing about celebrity, yeah. I can do more good with one foot on one side, one foot on the other.
Famous for her stunning beauty and her hit movies like Lara Croft, Tomb Raider. An Oscar for Girl Interrupted.
I'm playing the villain, baby, just like you want.
For her pairing with superstar Brad Pitt, together in Mr. and Mrs. Smith.
Who's your daddy now?
And their 6 children. As an ambassador of goodwill in Africa and Cambodia. And again today, with her op-ed piece in the New York Times and the stunning revelation that she had had a preventative double mastectomy. She wrote, "My doctors estimated that I had an 87% risk of breast cancer. Once I knew this was my reality, I decided to be proactive and to minimize the risk as much as I could." I've interviewed Angelina several times, a few years ago after ovarian cancer took the life of her own beloved mother at only 56.
Oh, I don't want to cry. You know, she was just a very, very loving person. She was completely full of love and kindness. And it's the legacy that she left. You know, she didn't become a great actress. She didn't become somebody anybody knew. She didn't do anything other than love her children and raise them with so much care. And so she's taught me a lot about the importance of that, of just being, just everyday kindness. And I think it's the most important thing about being a mom.
Today, she said she is speaking out for her mother. My children will never have the chance to know her and experience how loving and gracious she was. They have asked if the same could happen to me. I've always told them not to worry, but the truth is I carry a faulty gene. In February of this year, Jolie underwent the major surgery, an 8-hour operation in which the breast tissue was removed before temporary fillers were put in place. Just 6 weeks later, March 26, Angelina took a humanitarian trip to the Congo, not even telling her traveling companion. And April 4th, she attended the Women in the World Summit in New York, appearing relaxed. The next day, she took her kids shopping. Amazingly, one of the world's most chronicled celebrities managed to keep her secret from the press. Until today, in that revealing op-ed. On a personal note, she wrote, "I do not feel any less of a woman. I feel empowered that I made a strong choice that in no way diminishes my femininity." Jolie tested positive for the gene called BRCA1. Women who carry these mutations have, doctors say, about a 65% risk of developing breast cancer. For Jolie and other women like her, the choices are stark. In 2005, Jessica Queller was a successful television writer.
My mother had had breast cancer, which she beat. 7 years later, she was diagnosed with stage 3C ovarian cancer, and she died 2 years after that. I just decided, you know what, I should just, for peace of mind, take the test.
The results? Positive. Jessica was at a high risk for developing breast cancer.
To me, breast cancer is the worst thing in the world. I don't want to gamble with it. I don't want to gamble that maybe we'll catch it early enough.
She decided to have the double mastectomy. Today, 8 years later, Jessica is the mother to 3-year-old Sophie, who she had via an anonymous sperm donor after 9 attempts to become pregnant.
My daughter is the light of my life. I don't have words to express how much I love this little creature.
Queller says Angelina Jolie is a role model to the world.
If you can walk around saying, well, Angelina Jolie did it, you know, if you're a 30-year-old woman, then that can give you a lot of confidence.
Jessica braved all the medical procedures as a single woman, but Jolie underwent them with her partner, Brad Pitt, by her side. Today, Pitt issued this statement. Having witnessed this decision firsthand, I find Angie's choice, as well as many others like her, absolutely heroic. All I want is for her to have a long and healthy life with myself and our children. This is a happy day for our family. Jolie wrote, "We managed to find moments to laugh together. We knew this was the right thing to do for our family and that it would bring us closer." And it has. Jolie says she chose to share her story now, wanting more women to get tested and know their options. Life comes with many challenges, she wrote. The ones that should not scare us are the ones we can take on and take control of.
And they can use this knowledge to make choices.
Today in the Bronx, we met Susan Klugman, a doctor of clinical genetics for 25 years at Montefiore Medical Center. She counsels women about the risks of breast cancer and when to consider surgery, and to make sure they have the insurance to cover it.
Everyone has the BRCA gene. The way that the BRCA gene functions is it protects you against breast cancer and ovarian cancer. If there's a change in that gene or a mutation, the patient loses the protection against cancer and is therefore predisposed. I applaud Angelina Jolie. I think she was very brave, and I think it's great what she's doing for women.
Cancer is still a word that strikes fear in people's hearts, Jolie wrote. But at least for her, the chances of developing breast cancer are now just under 5%. I can tell my children that they don't need to fear they'll lose me to breast cancer.
I'm Angie.
And she looks forward to continuing her work, traveling to the poorest and sometimes the most dangerous places on earth, visiting the world's most vulnerable children at orphanages and refugee camps.
You finally pick yourself up and think, you know, my God, that woman just crossed a border with 5 children and no food, and she's not complaining about anything. She just gets on. So we all have to just get on and do what we can.
I understand why you do it now. Why did you do it to begin?
I think everybody needs a sense of purpose, a sense to be useful. And, you know, I'd been working on films or doing things to try to work on my own career, my own life. And so certainly there was an emptiness in me.
Jolie has long fulfilled any sense of emptiness with empathy. She told me what it means to be a mother to her 6 children, 3 of them adopted.
Just letting the kids know how much they make you happy, you know, is the great gift to give them, other than the discipline's important and all of this is important and what you give them in their schooling and their education, all of that very important. But the most important thing is to let them know what a joy they are for you and what a pleasure it is to be their mother.
As the world learned again today, taking the lead is something that Angelina Jolie has never shied away from. For Nightline, I'm Cynthia McFadden in Tucson, Arizona.
Coming back to the slides, breast cancer is the most frequent cancer in women, as we mentioned, and then we had 1.15 million people, women with cancer in the year 2002. So this is the prevalence of the disease. Is the main cause of death by cancer in women. Is the 50th cause of death overall for women in the world. Is fatal in 50% of the cases. We have 2 types of cancer, as I mentioned before. We have a premenopause and a postmenopause. Premenopause is less common. It affects women before menopause. And the most common is postmenopause that are after 50 years old in general. The protection factors for both, as we mentioned in the beginning, is diminished menstrual period. So if the women start the menstruation or the menarche late would be an advantage, and if the menopause starts earlier would be a big difference. And then not being pregnant at an early age and have children and have, not being, well, I already mentioned not have a menopause in early years. And then this, important for this probably is using a better diet, rich less in fat, less in animal food, and rich in fruits and vegetables, and do regular physical activity. And then breastfeeding. Breastfeeding is in general one of the best way to prevent the most common form of breast cancer, that is postmenopausal breast cancer. So breastfeeding decreases the risk of both pre- and postmenopausal types of cancer, of breast cancer. It looks like it decreases the exposure to female hormone when lactation accompanies amenorrhea. Other mechanism is that the exfoliation of the breast cells promote apoptosis and elimination of cells with damaged DNA. Who is gonna get those cells? Probably the baby, unfortunately. But it looks like there is no relationship between breastfeeding and cancer in babies, so don't worry about that. No effect on that. In fact, there is several other advantages for the baby. There is a tendency to have a higher IQ for babies that are breastfeeding, decrease infections, decrease Crohn's disease and ulcerative colitis that are intestinal diseases that are related to the immune system, decrease of cancers like the Hodgkin's lymphoma, that is a very complicated cancer, decrease in childhood leukemia, and decrease in diabetes type 1. Only mention about these two diseases, leukemia, that is very common in children, not very common but very tragic in children, and diabetes type 2, that is also a tragic thing. If women will breastfeed, their kids will have a lower risk of that. Also a lower risk of asthma and eczema, and a lower risk of obesity, both for the mother and for the baby, and less cavities. The other important thing for breast cancer is alcohol drinking. There is an increase in 5% for 5 doses for women that drink 5 doses of alcohol per week. There is a 10% increase for those who drink 10 grams of ethanol per day. There is no threshold found. When we say that, it's because there is some tendency to say, at least the Europeans researchers, they mentioned that alcohol is protective to the heart and to longevity for those that use moderate alcohol. But then when they don't use alcohol, they have a higher risk of heart disease. But again, when they drink too much alcohol, it goes up the mortality for the heart. So the heart would have a different type of mortality with a threshold, meaning that not drinking is not good. Drinking a little bit is good, but drinking too much is bad. In terms of breast, there is no such a thing. Whatever you drink as a woman, you increase the risk. And the risk is increased as much as it. 10% increase for those that drink 10 grams of ethanol per day is going to be similar to 1 drink per day. So if you drink 1 beer per day, that is considered normal or advisable for women, or 1 ounce of liquor, or have a cup of wine, you are increasing your risk of breast cancer for 10%. So again, if you put a woman that is a BRCA positive woman, and then you add alcohol, and then you add other risk factors, you are at an increased risk. So why using that? I would say you better eliminate this from your diet. Taller women are at increased risk. You cannot do much about that. But probably this is related to excess of energy and fat during puberty. So this calls for attention to how we treat our children, how we feed our children during puberty and adolescent years. So when they are growing, when they are maturating, and we should not feed them with junk food and high fattening food and high animal foods. We should put more fruits and vegetables and have a diet rich in fiber. If we go to China, you see that animal food makes a big difference. In this study, even though it's an old study, but they referred that almost a double rate of cancer, breast cancer, in women that eat more times per year of meat. Is some almost 4 times more eating meat. Women that eat 4 times more, 185 compared to 40, would have a rate almost double of breast cancer. So this calls for more control of animal foods in our diet. Even relatively small additions to the diet of meat, milk, and fat are associated with increase of a level of estrogen, testosterone, and an early menarche. This was a message from Dr. Campbell from the China study. So what he's saying is that early menarche will be produced with a diet rich in animal foods. There is some evidence that virtually there is no breast cancer in populations who consume less than 10% of their calories from from fat. This is, again, an old study, but it's still some evidence that high amounts of fat, essentially from animal fat, will increase the risk of the cancer. One of my colleagues here, Dr. Padma Uppala, did a research in the lab, and she was able to prove that lycopene was important to prevent the growth of breast cancer cells. In the lab, I mean, doing an experimental that was not in vivo. But at least there is some evidence that lycopene might protect against the disease. Lycopene is found in tomato, but not only tomato, as I mentioned before, watermelon and all the red components of a food, mostly vegetable foods, will be rich in lycopene. So the risk of breast cancer in the premenopause is increased according to the birth weight of the child. So child that are having a higher birth weight, above 9 pounds or 4 kilograms, will have a higher risk of breast cancer premenopause. Tatiana here was born with 7.75 kilograms of 17 pounds, one of the biggest babies in the world and one of the biggest, for sure the biggest girl in the world, but a strong candidate for premenopausal cancer. So parents, women especially, because it's very common that the diet that the women have during pregnancy might affect the birth weight of the child. Being overweight, however, is linked to a decreased risk of premenopausal cancer if the person is overweight during the period of 18 to 30 years, or 18 to even more, 18 years to menopause. So we don't understand very well that, but as we know that increased weight will increase the risk of cancer in postmenopausal, we don't advise you to be overweight to prevent premenopause cancer. There are other things that you can do for that. And again, the premenopausal cancer are very rare. I mean, it's not as common as the postmenopausal ones. Then for postmenopause cancer, you can say that the waist circumference or the fat that you have in the abdomen is one big factor. And then being overweight when you are young might decrease the risk. But who can be overweight when you are young and then does not continue to be overweight in adult age or postmenopausal age? That's almost impossible. So the research is a little confused on that, but my opinion is that, come on, being overweight is not a good factor for anybody. So you better control your weight when you are premenopausal, because in practice, it's very difficult to control your weight when you pass menopausal. Most of my patients that have struggled to lose weight are postmenopausal women. So as it will increase the risk of breast cancer when you are postmenopausal, it's not a good idea to be overweight during premenopausal times. So my advice is that try to control your weight as much as possible, as early as possible. Fat consumption in most studies do not confirm the effect on the risk of breast cancer. But we will come back to this issue later when we talk a little more about fat and breast cancer. So the American Institute of Cancer Research is saying that there is a risk of excess weight and drinking alcohol that increase the risk of breast cancer. And then exercise and breastfeeding decrease the risk of breast cancer. I like this slide, it's very well done. And the American Institute of Cancer Research says that 33% of U.S. breast cancer cause about 1 in 3 person in the United States have breast cancer. And then if they decrease the weight and they breastfeed, they could, there is a potential to save more than 82,000 deaths if a person just do something like that. That's the importance of developing this, because both exercise and breastfeeding will affect both premenopausal and postmenopausal breast cancer. What is the mechanism for breast cancer after menopause? There is an increase with the weight. There is increase of estrogen production. And there is also a decrease in the sex-binding hormone protein. These are circulating in the body, and then these proteins will bind to the sites or receptors in the breast and in the ovaries, and will prevent that the estrogen will affect them. And then these are decreased in menopause, and that might create a more risk for the cancer development. Also, there is an increase in insulin and an increase in insulin growth hormone that might be related to the promotion of cancer. Remember, insulin is a cancer promoter. That's why some diabetics have a high risk of cancer, because mostly diabetes type 2, in the beginning of the disease, they have a hyperinsulinemia or hyper secretion of insulin in circulation. Also, there is a risk or a higher level of inflammation once you reach menopause, and inflammation might increase the risk of cancer. There is a decreased level of physical activity, and then we know that physical activity will decrease estrogen and androgens hormones. So more level of physical activity will increase the menstrual period and decrease ovulation. We know that many times women, when they are premenopause, when they are with the periods, that some women will even stop the periods if they do too much intensive exercise, mostly the athletes. Pesticides and cancer, well, the studies did not confirm the fact. At least one of the studies done in Long Island, where there is a high incidence of breast cancer, they were checking for PCB or DDT, and they find a very high concentration of these pesticides in breast of women with breast cancer. But the studies confirmed that even women without breast cancer, they have all these concentrations too increased. So this might not be unique to breast cancer and might not be related. But the issue might not be totally concluded. These Tettelbaum researchers said that use of house pesticides might be related to breast cancer. But still, there is unlimited, or there is not unlimited, there is limited resource or studies to confirm this effect. Fat intake was not related to the cancer in most in recent studies. However, the WIN study found that less incidence of cancer recurrence when a lady or women with breast cancer started to do the period of survival. So the WIN study is the Women's Intervention Nutrition Study, and was published in the Journal of National Cancer Institute in 2006. They went to checking over 2,400 women with early diagnosis of breast cancer. So the control that was using about 50 grams of fat per day was compared to the experimental group that was using 30 grams of fat per day. And during the 5 years, the experimental group lost 5 pounds of weight in average. But the more important thing is that the low-fat group, they have a 9.8% recurrence of cancer, and the control group has 12% of recurrence of cancer. So there is a difference statistically of 24% decrease in relative risk of the disease. And the drop in non-estrogen related types of breast cancer was increased, the difference was 42%. And I would say even, I don't know, but I would think that a difference with a lower fat diet might have a big increase in the effect of the low fat in the prevention of this type of cancer. The effect of vitamin D, it looks like patients who were deficient in vitamin D were 94% higher risk to have breast cancer spread. So not that they would not have the cancer, but they will have a higher chance of metastasis. 73% more likely to die compared to patients with normal levels. So also a higher risk of death because of lack of vitamin D. This is a study that came from Canada. Another study is showing that lower vitamin D levels increase the risk of death by the cancer. More likely to have premenopausal breast cancer, and more likely to be overweight. So lower vitamin D might be precursors of the other things. And then they might have more aggressive tumors. So vitamin D deficiency might also be related to colon cancer and blood cancers and heart disease, according to Goodwin studies. High fat intake increases the risk. High intake of calcium protects menopausal breast cancer. Soy might be a protective agent also, using 20 milligrams per day or more. Garlic also is protective, and red meat increases the risk of premenopausal cancer. Now we are talking about the information not from the American Institute of Cancer Research, but from the book Lifestyle Medicine by Dr. James Rippey and other authors. In 2010, they got these results. From Dr. Rippey again, there is a protection for premenopausal cancer with weight. And then the risk of developing breast cancer is decreased by 1.5 times when we compare women with healthy weight. Women with abdominal distribution of fat are at greater risk of developing breast cancer than those with the fat distributed over the hips and buttocks and thighs. So it's not only to be overweight, but where the fat is deposited. Obese postmenopausal women produce nearly twice the level of estrogen and postmenopausal women with healthy weight. The ones that have that are obese after menopausal, they produce a lot of estrogen, as we see in this slide. Higher risk of cancer death in overweight women. So it's not just to be in the higher risk of the disease, but the death risk is increased. Experts believe that this can be attributed to a delay in detecting a palpable tumor mass, and then when they made the diagnosis, they don't see, then they made the diagnosis too late, or the cancer is advanced. Black women have a more chance of advanced stage breast cancer at diagnosis, probably also related to not having a breast test done, or not able to be to have a mammogram due to healthcare access to healthcare. Hispanic women who are overweight have increased the risk of cancer independently of menopause status. So overweight women Hispanic overweight women has increased premenopause and postmenopause types of cancer. Fruits and veggies in the nurse health studies protect against the cancer. Beta-carotene from food and supplements also, and lutein and zeaxanthin and vitamin 8 from foods protective. And this, there is a protection from premenopausal cancer in women that eat 5 or more servings of fruits and vegetables, and that those that have a family history of breast cancer. The EPI study didn't find any effect on the fruits and vegetables for women, and then there is a weak association with alcohol and no association in general with fruits and vegetables intake. And then they have these slides showing the association according to countries. Some countries are positive, some countries are negatives. I would say that this would be a good idea for where you are. So if you live in a country that has a big association, you should care more about your fruits and vegetables intake, not only for breast, but for in general prevention. Again, this is another issue on associations with fruits and vegetables and breast cancer, according to breast cancer. Overweight is related to breast cancer in postmenopausal women. We already know about that. And then moderate exercise, even moderate exercise, lower risk of breast cancer in this study. So what is the treatment that there is available for breast cancer? Radiation, surgery, not necessarily all the time a mastectomy, but a lumpectomy, that is a portion of the breast, and then chemotherapy and hormone therapy. So there is also prophylactic surgery for people with high risk, as we saw in the case of Angelina Jolie, and then for preventing the recurrence of this cancer, they are using tamoxifen. But tamoxifen, it can reduce by 50% the reincidence of breast cancer, but it can cause endometrial cancer, can cause thrombosis, and then embolism. Also, raloxifene is another drug that can help the prevention of recurrence of breast cancer, but can cause thrombosis and embolism. Well, you know that every drug has a side effect, so we have to balance the pros and cons and see when women need and during what time they might need this to prevent a cancer, if the cancer is more advanced than women that are more with a lower risk of reincidence. There is a chance that some women that have this overexpression of this gene might use this drug trastuzumab or trastuzumab or Herceptin. specific for these women that have this genetic profile that increase the risk of breast cancer. So this drug will help to prevent. And now for the good news. First thing is that turmeric can decrease the risk of at least the spread of the breast cancer, and improves the effectiveness of current remedies. So if a person has breast cancer and are using chemotherapy, according to this study, it could decrease the chances of an advanced cancer with using more turmeric. Turmeric studies done in rats that it can decrease the development of metastasis to the lung in 95%, decrease 75% the development of metastasis, and then when used with chemotherapy, only 22% of the rats had metastasis. And then I'm gonna finish with a story here, simple story. Once upon a time, I have a lady that came to my office because she had done a surgery to extract a cancer in her breast. And then she has not been advised to do any follow-up in terms of diet. And then she asked me what would be the best diet for prevention of cancer or for a cancer patient in this case. I told her, well, lots of fruits and vegetables, whole grains, beans, roots, nuts, seeds, mushrooms, no animal food, no junk food, avoid refined foods, all made with refined grains, and then avoid high-fat foods and sweets and sugar. And she seems that she got the message. And then she went back. She was living in the Philippines, and I haven't heard from her for a long time. One day, in another lecture, a lady approached me and said, "Don't you remember me?" And I said, I said no, and said, "I am Janet, the one with the cancer, with the breast cancer. And I have followed your advice, and I had no problem with cancer whatsoever." I told her, continue with the diet, and don't forget to check with your doctor with a normal follow-up. So I'm not saying that all the women will have that. I'm not saying that the cancer will never return, but I still believe that we should advise people to eat a diet that is rich in fruits and vegetables, soybeans, yellow vegetables, avoid meat and animal products, and control your weight. Avoid hormone treatment as much as possible. Avoid the exposure to pollutants in the environment like cadmium and others. Avoid using pesticides, at least at home. And then breastfeed and avoid alcohol. For sure, avoid alcohol would be in the first of the list. So if you want to do a risk assessment of cancer, you could go to this cancer site or this website from the National Cancer Institute, and you can have respond to several questions there and have an easy assess of your risk of cancer on this site. So I would advise people to go there. And I finished this with a message for everyone. Wine is a mocker, strong drink is raging, and whosoever is deceived thereby is not wise. And I believe the women that are drinking are not wise if they are going to prevent breast cancer. As breast cancer is very common among women, one thing should be sure: avoid alcohol as much as possible. Thank you very much, and we will see you in the next session of the Cancer Prevention Seminar.